to the benefits of multidisciplinary and integrated care in the management of bladder cancer. This is a patient insight webinar from the Bladder Cancer Advocacy Network. We'd like to thank our sponsors, Estella Seattle Genetics Partnership, Bristol Myers Squibb, the EMD Serona Pfizer Partnership, Fairgene, Genentech, Janssen Oncology, Merck, and PhotoCure for their support of the Patient Insight webinar series. Bladder cancer is a devastating disease with an estimated more than 80,000 new cases expected each year. When diagnosed, some patients receive multidisciplinary care that occurs when professionals from a range of disciplines work together as a team to address many of the patient's health and other needs as possible. Integrative care adds the benefits of complementary and supportive care services to address the body, mind, and spiritual needs. My name is Stephanie Chisholm, and I'm the Director of Education and Research at Beacon. I'm joined today by leading bladder cancer experts from the Inova Shar Cancer Institute, the Life with Cancer program in Fairfax, Virginia. We're here today with Dr. Jeannie Aragon-Ching, Dr. Sam Lolak, and Ms. Karen Broshak. Dr. Jeannie Aragon-Ching serves as the Clinical Program Director of Genitourinary Cancers at the Inova Shar Cancer Institute, and she also has an academic appointment as an Associate Professor of Medicine at Virginia Commonwealth University. She conducts clinical trials and cares for patients with bladder cancer. Welcome, Dr. Aragon-Ching. It's nice to have you with us.
Thank you.
Dr. Sam Lolak is a psychiatrist at the Life with Cancer Inova Shar Cancer Institute, and he has an academic appointment as an Associate Professor of Psychiatry at Virginia Commonwealth University. Dr. Lolak specializes in the management of psychiatric issues such as depression, stress, and anxiety in the context of cancer diagnosis and treatment, including drug interactions between cancer therapies and psychiatric medicines. It's nice to have you with us, Dr. Lolak. And then Ms. Lauren Broshak is a licensed clinical social worker and oncology clinical therapist at the Life with Cancer program at the Inova Shar Cancer Institute. She offers therapy and facilitates support groups for patients and families touched by cancer. She also sees patients in the clinic with Dr. Aragon-Ching and coordinates care with Dr. Lolak to provide comprehensive and integrative care at Inova. So I'm going to start the program, and Dr. Aragon-Ching, I will let you take it away.
Well, thank you so much again, Stephanie. It's wonderful to be here and to share with you all regarding bladder cancer. In terms of our program for this evening, I would really want to touch on some of the bladder cancer basics, statistics, really diagnosis, staging, and management. And I want to highlight the ability for us to really see patients in a multidisciplinary clinic and offer and deliver care in such manner where we can integrate psychosocial care, integrative oncology, and supportive care systems at Inova. And finally, I would like to be able to highlight, how we deliver that care by putting it all together in a patient case. So let me start off with there. So the projected 2020 bladder cancer statistics as we know it. You can see here on the left-hand panel that bladder cancer occurs more commonly in males than in females. It is the fourth most common incidence of cancer in males and about the 8th most common cause of death in males. Now, you don't see this same statistics in females, but unfortunately, we also know that females do fare worse with prognosis in terms of the disease at each state of the disease compared to men. And there is more to this in a previous webinar that you can click on the screen, a webinar that Beacon also had in December. Now, when we look at the incidence and overall survival in 2019, for instance, there was an estimated 80,000 cases of bladder cancer that makes up 4.6% of all new cancer cases. and it made up 2.9% of all cancer death. So if we look at the 5-year survival, it approaches about 77%. And if we look at the age distribution, the median age at diagnosis is about 72 years of age. But you'll see also in this chart that patients over 75 also have a high incidence of developing bladder cancer, but also younger people, less than 64 years of age, also has an 18% incidence. And you'll see that even patients as young as 45 to 54 years of age has about 66% incidence. And if we look at the race distribution on the left, this is the stage distribution according to SEER. We see that majority of bladder cancers are diagnosed in the localized disease states, but there are also distant disease. And if we look on the right, the 5-year relative survival, there is still a discrepancy with race amongst white versus Black patients. Now, how do we make a diagnosis of bladder cancer? So on the left, cystoscopy, which is looking within the bladder, and a resection, transurethral resection of the bladder tumor is necessary and an important tool for the diagnosis. Evaluation by an expert pathologist is a must because not all bladder tumors are going to be urothelial or transitional cell cancers. There's going to be variants, and different variant of bladder cancer and different histologies may require different treatment options. Imaging is a very important tool for the staging, so we often utilize CT scans or MRI for staging. And finally, it's a very important aspect of care to have evaluation by a multidisciplinary team. Now, staging of bladder cancer encompasses what we call the TNM staging. So it looks at the tumor depth, the node status, as well as presence or absence of metastases. And if you look at the grading on the top left corner, it tells us how aggressive bladder cancer is. And if we look at the tumor stage on the bottom right-hand corner, the depth of the tumor also dictates what the T stage would be. Now, the nodal status is also important because depending on the degree of involvement, if it's just one area of regional lymph nodes versus multiple regional area like N2, and if you have multiple lymph node involvement in the common iliacs, that's N3, and if it's beyond that in the retroperitoneum, that's already a more involved N3 and beyond M1A, and that makes up a stage 4 cancer. So the nodal staging is very important in the assessment and evaluation. So treatment of bladder cancer, I would just divide this into big concepts. So certainly for superficial bladder cancer, it's very important for read resection, repeat TURBT to get adequate staging. And certainly intravesical treatment is a big part of treatment for superficial bladder cancer. Now, when we see muscle invasive bladder cancer, this is where the opportunity for a multidisciplinary approach would be, because a patient may so choose and be offered cystectomy, cystoprostatectomy, and certainly in women, it's a different surgery where also anterior exenteration would be seen. Neoadjuvant chemotherapy is an integral part of that care. However, there are some patients who will be well suited for bladder preservation strategies like combined chemoradiation. Certainly, clinical trials is an important part of any phase and disease stage wherever applicable. Now, for patients with locally advanced or metastatic bladder cancer, certainly a lot of systemic therapy modalities, including chemotherapy, immunotherapy, targeted therapy, and certainly clinical trials play a role.